Bone cancer is a rare but serious disease that affects the bones. It is a condition that requires immediate medical attention and thorough understanding. It occurs when abnormal cells grow uncontrollably in the bone, leading to the formation of tumors. These tumors can be benign or malignant, with malignant tumors being cancerous and more dangerous. This abnormal growth destroys healthy bone tissue, weakening the bone structure. As the cancer progresses, it can cause severe pain, fractures, and other complications. Bone cancer can develop at any age, affecting both young and old. It does not discriminate, making awareness and education about the disease essential for everyone. However, it is more commonly diagnosed in children, teenagers, and young adults, making early detection crucial. Young patients often face unique challenges, and early intervention can make a significant difference in their prognosis. There are two main types of bone cancer: primary and secondary bone cancer. Primary bone cancer originates in the bone itself, while secondary bone cancer spreads to the bone from other parts of the body. Primary bone cancer starts directly in the bone itself, often requiring aggressive treatment. This type of cancer is less common but can be very aggressive, necessitating prompt and intensive care. Secondary bone cancer, on the other hand, spreads to the bone from other parts of the body, complicating treatment. This type of cancer is more common and often indicates advanced disease, requiring a comprehensive treatment approach. Understanding the different types of bone cancer, their symptoms and treatment options is important for effective management. Treatment may include surgery, chemotherapy, radiation therapy, or a combination of these methods. Early detection and timely treatment can significantly improve outcomes for patients, offering a better quality of life. Regular checkups and being aware of the symptoms can lead to earlier diagnosis and better treatment success.
Primary bone cancer originates in the bone itself. This type of cancer is relatively rare compared to other forms of cancer. It accounts for less than 1% of all cancers diagnosed each year. Despite its rarity, primary bone cancer can be aggressive and requires specialized treatment. It is much less common than secondary bone cancer, which is more frequently diagnosed in patients. Secondary bone cancer, also known as metastatic bone cancer, occurs when cancer cells spread from another part of the body to the bones. This type of cancer is more prevalent and often indicates an advanced stage of the disease. There are several types of primary bone cancer, each with unique characteristics and treatment approaches. Understanding these differences is crucial for effective diagnosis and management. Osteosarcoma is the most common type. It primarily affects children and young adults, typically between the ages of 10 and 30. This cancer often presents during periods of rapid growth, such as adolescence. It usually develops in the long bones of the arms and legs, particularly around the knee and shoulder areas. Early symptoms may include pain and swelling, which can be mistaken for sports injuries or growing pains. Chondrosarcoma begins in cartilage cells and is often found in the pelvis, hips, and shoulders. This type of cancer tends to grow slowly, making early detection challenging. It is more common in adults over the age of 40. Ewing sarcoma typically affects the long bones and the pelvis, but can occur in soft tissues as well. It is more common in teenagers and young adults, particularly those between the ages of 10 and 20. This cancer is known for its rapid growth and aggressive nature. Secondary bone cancer starts in another part of the body, like the breast, lung, or prostate. It is more prevalent in older adults. This type of cancer often indicates that the primary cancer has advanced and spread, leading to more complex treatment needs. Cancer cells then spread to the bones, causing significant pain and complications. These complications can include fractures, high calcium levels in the blood, and reduced mobility, significantly impacting the patient's quality of life. This is also called bone metastasis. Treatment often focuses on managing symptoms and improving quality of life. Options may include pain management, radiation therapy, and medications to strengthen bones and reduce the risk of fractures. The goal is to help patients maintain as much function and comfort as possible during their treatment journey.
Bone cancer symptoms can vary depending on the type and location of the cancer. It's important to be aware of these symptoms to seek timely medical advice. Early detection can make a significant difference in the effectiveness of treatment and overall prognosis. Pain is a common symptom, often starting as a dull ache that worsens over time. This pain can become more severe and persistent, affecting daily activities. It may be felt deep within the bone or in the surrounding tissues, and it can be particularly noticeable at night or during physical activity. Swelling or tenderness near the affected area is also common. This swelling can sometimes be accompanied by redness and warmth, indicating inflammation. Other symptoms can include noticeable lumps or masses, which may be felt under the skin or seen as a visible bulge. Weakness or fracture in the affected bone, making it more susceptible to breaks, is another critical sign. Bones weakened by cancer are more prone to fractures, even with minimal trauma or stress. Fatigue and unexplained weight loss, which can significantly impact overall health and well-being, are also concerning symptoms. This fatigue is often persistent and not relieved by rest, while weight loss can occur without any changes in diet or exercise. Fever that comes and goes, often without any clear cause, can be another indicator. This intermittent fever may be a sign that the body is fighting an underlying issue, such as an infection or the cancer itself. If you experience persistent pain, swelling, or other unusual symptoms, consult a doctor immediately. Don't ignore these signs, as early intervention is key. A healthcare professional can conduct the necessary tests to determine the cause and recommend appropriate treatment. Early diagnosis is crucial for effective treatment. Timely intervention can improve outcomes and provide better management of the condition. By seeking help early, you can take proactive steps towards your health and well-being, ensuring the best possible care and support.